I do cardiac anesthesia. So if anybody needs a heart surgery, I'm the guy who puts you off to sleep, makes you nice and comfortable while they open up the chest to work on the heart and that kind of stuff, okay? So it's pretty important that we keep our heart and all kind of the blood vessels and everything, even having to do with stroke, kind of keep that all kind of taken care of. All right? So that's what we're going to be kind of going over today. All right? Stroke and stroke prevention. All right? So how to actually spot a stroke, okay? Like, tremendous problem in the United States. Usually happens in the age bracket of 55 and above, which might be somewhat pertinent to everybody around here, from what I understand, right?
Yeah.
So, almost 800,000 people have a stroke in the United States each year. Okay? That's a ton, for lack of a better term. Fourth largest cause of death in the United States. Okay? Number one is heart disease. So these are actually linked together. Okay? Making it all part of the same system. It's actually causing the same problem. Okay? Make sense?
Yes.
All right. So the challenge is, and the reason the American Heart Association is so interested in it, is that only 57% of people actually even know if you're having one, or what to do about it, even if you do, okay? So identifying that somebody's maybe having a stroke is really important, okay? So that's what we're going to learn about today. How do we actually identify a stroke? How do we know that somebody's actually having one, okay? So, could be your life, could be the life of someone you love, could be somebody that's just down the hall that you're like, they look a little weird today, all right? And you actually just notice it, all right? So, what is a stroke? Two different types of stroke, okay? One is ischemic stroke. That means there's a clot. The clot has gone off. It's killing all the brain behind that point because no blood's getting to it, okay? That's the most common type of stroke, okay? Second most common type of stroke is what they call a hemorrhagic stroke. So like when there's an actual brain bleed, okay? When there's bleeding in the brain, blood vessel gets real weak, usually like an aneurysm, kind of pops open. Everything beyond that is not getting blood, okay? If it's not getting blood, it's going to die, all right? So at that point, it becomes really important. The saying goes, time is brain. So even minutes, you want to know right away when and if something like that's happening, and you want to go for help, okay? Call for help and get them taken care of right away. Easiest way to help out and reverse it, if it's possible, is earlier detection the better, okay? So, like I said, pretty much the warning signs for strokes kind of before the fact strokes are what they call TIAs, okay? They're kind of little warning sign strokes. It's not one of those things to where like you notice that, hey, I can't move my arm, can't move my leg, but you notice that there's little other things like I'm having memory loss, or I was just kind of out of it for about a half an hour yesterday. I'm okay now, but I was out of it, you know, like for about a half hour. Or you notice that in another person. Sometimes it's much easier to notice it in somebody else than it is to notice it in yourself. Okay? You're just like, you seem a little off right now. Those are kind of the pre-strokes that kind of can lead to what Sanford would say, the big one. Okay?
Yeah.
So like, not so much for the heart, but for the head this time, okay? So those are kind of your warning signs. You want to be careful. So if you're noticing those, you want to make sure that you're doing the right thing, okay? Right thing would be calling 911, being seen by a physician, making sure that you're kind of optimized for that kind of thing, okay? So, they have a nice little acronym for you so you can remember very easily. It's called FAST, okay? F-A-S-T, okay? So, facial droop. You notice that somebody just doesn't have much going on one side of their face. You can ask them to smile. What will happen is one side goes up and the other side just kind of sticks where it was. Okay, not a whole lot happening. That means that they may very well have a stroke, but regardless, you can call 911 because you have to have that checked out right away. Okay? The longer you wait, the harder it is to reverse that. Okay? That's the A. F. So, facial droop. Okay? A is for arm. Okay? You'll have them lift their arm and like one, usually it will just kind of fall down. And they'll think that they're like raising it, but it'll kind of drift on them. It'll kind of fall. Okay, that's another sign that they could be having a stroke. Okay, S. S has to do with speech difficulty. All of a sudden they're starting to slur everything that they're saying. Everything is coming out in a very slurred type tone. Okay, that's a pretty indicative sign that it's probably stroke. They usually don't notice if they are. Sometimes they will. That's why it's important to not only notice it yourself, but other people as well. Okay. And then T, time to call 911. Bless you.
Thank you.
You got it. So if you notice if you notice any of these symptoms, call 911 right away, because that sort of thing is super duper important. If you can remember when those kind of started, that'll have to do with the treatment that we're able to do in the hospital for someone once they get there. Okay? But if you call as soon as that actually happens, they're already going to know when you call. So they have that kind of worked out for you. Okay? Other things that you could look out for, other than just the FAST. Okay? All right, this severe headache. All of a sudden, it's a huge pounding headache, and you never get pounding headaches. That's a key indication. Could be a stroke. Okay? Sudden dizziness. You're having dizziness. You can't walk straight. Everything's kind of getting a little blurry. Maybe one of your legs starts to go numb. No apparent reason. Usually not numb. Now it is numb. Very strange. Trouble seeing out of one eye. A lot of those are indications that you could be having a stroke. Okay? So, what do? If you're having a stroke, call 911. Okay? Just, it's super duper important, as fast as possible, to go ahead and call, get the person taken care of. Okay? So it's all about just recognizing those symptoms and being able to kind of help them. Okay? So, why time is so critical? Everything beyond the clot or the bleed is not getting any blood supply, so it's basically dying. Okay? Much in the exact same way a heart attack is. Consider it like a brain attack. Okay? You have an artery, you have something that kind of got stuck there, everything beyond it is no longer getting any nutrients. That tissue won't last long, it's going to die. Okay? So there are interventions that they can do at the hospital. They can give medication that can bust up that clot. They only have a small window that they can do that, around 90 minutes, 180 minutes sometimes. Okay? So it's not that long. They're not able to do it for terribly long, so that's why it's important. If you notice it, you get them checked out immediately. Sooner is always better. Okay? A lot of people will say, oh, well, we'll see if it goes away. It might be all right. That's a common tendency. You know, like, you'll be all right. Give it in a couple hours, or give it till tomorrow. And tomorrow, it's likely too late for that kind of thing. Okay? At that point, the damage is done, and sometimes it's irreversible. So, earlier, always better. If it's a false alarm, then that's completely awesome. False alarms are just fine. Okay? We're happy to help out with them. Okay? They even have a cool little app for you at the American Heart Association. It's the FAST app. So basically, it kind of tells you kind of exactly what to do. It's real fast, easy for you, and kind of how to kind of spot a stroke. So to review, FAST first, face, right? One side drooping, ask them to smile, can't do it, right? Second one, arm, thumbs up. Can be either arm, doesn't make any difference. Sudden weakness in the legs, that kind of thing. Okay. Speech, they're starting to slur everything. They usually talk much more clearly, and all of those other words. That's very clear indication they're probably stroking. Okay. And then it's time to call 911. All right. So relatively fast and easy. So tell me, your question.
I have a question. I was
Yeah.
just going on what you said. I'm writing down fast, and I missed the last one. What
Yeah.
was the last one?
Time to call 911.
Time to call them. Okay, I have another question.
Yes.
I've heard people call strokes. They said some people have a mild stroke or a mid stroke.
Yes.
Explain it.
So those are what they call TIAs. That stands for transient ischemic attack. Basically, that's a medical term for a mini stroke. Okay? Those are kind of the warning signs that you could have a stroke coming. Okay? For those, most commonly what you'll notice is that people are just confused for a little while, maybe half an hour, maybe an hour, that kind of thing. Kind of come back. Very mild, not too bad. Okay? Or, you know, like a little numbness here, a little off there, something seems a little weird. Okay? Those are like mini strokes. I'm thinking that's probably what's happening. So at times like that, what they normally do when you go into the hospital is they want to make sure that all the risk factors for strokes are taken care of, okay? Taking care of your heart. Number one thing, blood pressure. You can't tell whether your blood pressure is high until it's too late, okay? Because you don't have any symptoms of it. If your blood pressure is real high, you're not going to know it until you have a really bad headache. At that point, you're pretty much almost having a stroke, okay? So, my dad, I called him a few weeks ago. I asked him, how's everything going with your blood pressure? Oh, it's great. took the medication for a month, I feel fine, stop taking it. So what's wrong about that is that
I want to hear this part.
he stops taking the medication and the blood
know
pressure goes up. Do you know somebody like that too? So as you stop taking the medication, unless they check the blood pressure afterwards and the blood pressure was okay, it'll go back up. You won't know that it went back up. You won't feel that it's too high. But what's happening when it's too high is that it's making your arteries more and more brittle and more common for them to have that clot. Okay? Number one risk factor for a stroke is high blood pressure. The challenge with blood pressure, the good and the bad, is if you have high blood pressure, you don't feel bad. That's good.
Is he alright?
Do what?
Your dad, he alright?
Oh yeah, he's fine.
Okay, see what happened to me? I went to
Yeah.
movies, alright, the butter popcorn, all of the soft product.
Oh yeah.
And then I come out.
Good stuff.
It's a heat wave, right? Now, I don't know what made me go over the strollers, but I went over there. And sure enough, but this is the first time I heard, the blood pressure on 72.
Have they checked it afterwards at all or no?
No, I bought me, we had nurses come,
Yeah.
for a while, about a year, and I bought, my own little kit. And then I'd be out in the street and then I'd do about 5 miles, walk. The thing is this, it's changing your habits. Why is it so hard to keep them up? Okay, you got to quit eating certain foods, you understand? It's certain things you can do yourself, you know what I mean?
Sure.
But
Sure.
the thing is, I had to come to these meetings because I want to hear everything that I can possibly put in this computer.
Absolutely.
And then they say, I even massage my brain back, you know what I mean? But the thing I'm saying is, I don't want no stroke. See, I'm the type of person, wheelchair is over for me, I'm not gonna do nothing else.
It's gonna be pretty hard to walk 5 miles a day if you have to be in a wheelchair, huh?
Oh, I do 5 miles, I go to Jewel,
Yeah.
and I walk back, and then sometimes I might go a little further, but it has to be the 5 miles. Okay, then I gotta do push-ups, sit-ups, and the exercise. See, the doctors and the nurses, they be telling you, you understand, a roundabout way where it's about the pills.
I tell you sometimes, if your blood pressure is fine without any medication, then you don't need it.
Yeah, but you got to keep, this is what I'm saying, I got mine down one time, 125 over 75. But it goes, 90, I don't like the like I said, I take but anyway, I just come to make sure I will hear that.
Yeah.
Did your father, did he change the tire?
No, he went back to the doctor. They checked his blood pressure. Get his contact up again.
So now he takes the pill.
Yeah, he does that. Now he's already doing the other things he can do outside of medication.
Okay.
So he's already exercising. He looks after his diet. So he's doing the best he can in all the other areas. Sometimes, especially as we get older, sometimes there's not a whole lot we can do about blood pressure. Okay? You're exercising a lot, you're fit, you're eating correctly. That's as good as you can do those things just to help out. But if you need medication to bring it down, it's best to keep it lower, kind of within a normal range, because it's found to have less stroke. Yep. So those kind of the same things that cause a heart attack, right? That clot that comes through and clogs up the artery. That can be cholesterol based, so higher cholesterol can lead to higher strokes as well. Absolutely. It's all it's all related. Yes. Yeah, you never know. So
One more thing.
Yeah.
I heard on the news the other day, a glass of wine, red wine, is good for your heart.
A lot of people like to say that, don't they?
Is that?
Oh, I think it probably isn't bad at all. Moderation on almost. I think it's it's okay. You know what I mean? But they have shown that red wine, a glass of red wine a day, can be heart protective, so it can be actually good for you. I think it was the wine industry that actually put that down together, though. Okay.
I'm taking fish oil.
Yeah.
Other oils.
Get you.
Go ahead.
Oh, sorry.
Go ahead.
You're right, you're right.
But anyway, fish oil, and I read a long time ago in biology. You're not supposed to weigh over 20 pounds of what you weighed when you was a teenager. Yeah, that is when you start gaining over the 20 pounds, you know, you're supposed to stop right then and there. You know, I guess sisters and brothers, you know.
Well, what they say right now is everything is kind
The
of.
fat is what you got fat up underneath here, fat up underneath here. It's a lifetime job, we're asking yourself.
I hear you, bro.
It's a never-ending story.
I do.
Huh?
I do. So usually, like what they say now in the way of like kind of weight management is everything, however tall you are, determines how much you should weigh. Okay, so it's just all a calculation now. So taller people, you know, like theoretically can be fit at different weights than say shorter. Okay, so it's kind of a height measurement now.
That's what we get, it's on the scale. Okay, me, I'm 5 feet 11, I'm 3, okay, 6. I can weigh 172 pounds and still be healthy.
That's still considered.
164, I go down 164. Still be healthy.
And you exercising that much is good. That's great.
I walk upstairs, I do 22, the gym room is downstairs, I do 22 flights, you know.
You do 22 flights?
Yeah.
That's amazing.
I don't do a
I
lot.
don't think I can do 22 flights. That's pretty great. Does everybody do 22 flights a day?
Yeah, right. Yeah.
David, you do 22 flights, right? Grace.
Yes, my question is,
Yes.
what's the average blood pressure? Because it says like
Yeah.
120. So is that normal? So what if you like a 125 and 130 all the time? Is that high blood pressure, or is it high blood pressure, or is the numbers
So
change?
they have, right now in the literature, what they have is kind of different levels depending on what your risk factors are. So they want your blood pressure different if you have diabetes and if you don't have any diabetes, strangely. Okay? So like, it's different depending on the person, but it's all a range. Okay? So a lot of physicians will say anywhere between 100 to 130 without any other risk factors for your upper number. Okay? That's systolic, you know, like 120 over 80, that kind of thing. That's fine. Okay? They may want it a little lower depending on kind of your risk factors. Okay? So if you have, usually if you have high blood pressure, if you have high cholesterol, if you have diabetes, you're overweight, they're going to want your blood pressure to be a little lower, and they're not going to want it getting high because those other things are already making you more susceptible to a heart attack and a stroke. Okay? So they want to take a real good close eye on your blood pressure at that point. If you have absolutely nothing else going on at all, you're otherwise completely and totally healthy in all ways, then they may be a little more lenient on like a blood pressure. Okay? At that point, so you have a good diet, you have everything else, you don't have any other risk factors, it's a little less important then to keep your blood pressure right within that normal range. Does that make sense?
You know, my sister was always like 100.
That's good.
110.
That's good. Yeah. No, that's awesome. As it should be. That's why you have the Hot Wheels. Yeah, dude.
You know, I was concerned about my blood pressure because it fluctuates. And so the doctors told me that the medical association, I think it was the medical association, she said that the numbers have changed when it comes to the high blood pressure and the cholesterol.
They're always shifting them around a little bit. They usually don't change a ton, like
Okay.
drastically,
Okay.
but they learn new things all the time. They have really cool devices now that are actually kind of showing blood pressure on a continual basis. So not just like, oh, I took my blood pressure and it was 130 over 80. It's what it is over 24 hours.
Oh,
So a little transplanted device, stuff like that, they can actually tell what your blood pressure is over the whole day.
mhm.
We don't even have that kind of data available, like, who's ever had that before? So there's a lot of things like medicine-wise, like as a physician, like, we don't even know what a normal blood pressure is, really.
Oh, right.
For somebody over the whole day, you know? We take your blood pressure when? You go to the doctor's office, you're already having a little anxiety anyway. Blood pressure's probably a little high, higher than what it would be anyway, right? So sometimes, so basically it's getting better. It'll get better when we can actually monitor what it is
Okay.
a little more continually, you know, like whenever you're just like right now. Your blood pressure is going to be a little different than when you're on the 22nd floor after you've gone up the stairs, okay? Like, your blood pressure is going to fluctuate.
I do.
You don't do them all at once?
No. Me,
I didn't think so,
I think
okay.
you were great if you did.
when I'm in good shape, if I don't eat nothing, I can do the 22.
I understand.
Yeah.
None of that food holds you back.
Huh?
None of the food holds you back.
Level is the level.
22nd floor all the way
But
down.
that deal with him having a heart attack, he got high blood pressure, you know, like walking up the stairs. Because it's harder to walk up than it is to walk flat.
Walk down.
Well, it's all like that. It's kind of a balance. So usually, like what they say is what's optimal is like 150 minutes a week of exercise. Whether that's walking, running, swimming, whatever. Doesn't make any difference what it is, but moderate activity. That's 30 minutes a day, 5 days a week. So walking up the flights of stairs and whatnot, that can keep your heart very, very healthy. Now, if you don't walk stairs at all and you try to go up 22 flights, that's going to be stressful for your heart. But if you actually work your way up to that, to where that's normal for you, that's good for you. It's good for you to be able to kind of do that on a regular basis, you know what I mean? But if you're coming in cold and you're like, I haven't walked up 3 flights of stairs for 10 years, I'm going to do it today. That's like putting yourself through a stress test, okay? Like that's a little tough on your heart. So like you want to go a little easier on yourself than that. The first, yeah, I understand.
There's a lot of seasonings. There's a lot of seasonings. And I get different seasonings and that's I get.
Some seasonings that you put on your food, right? They'll have salt in them, okay? Salt can cause you to retain a little water, and you can be a little puffy. Okay, you retain water, your blood pressure can go up. Okay, so they say a lot of times with high blood pressure, you kind of got to watch how much salt you're eating.
Yes.
Okay, and that can sometimes be outside of just normal salt. It can be in seasonings and stuff like that. It's almost hidden a little bit, or like things that are really salty, like popcorn, or like chips, or things like that can be really salty. Yeah.
Excuse me, Brother, for a diabetic, which one is the normal high for the sugar be, like a lot of times mine still be the same, like 90.
Mm-hmm.
90.
Yeah.
That's most like normal, right? When it jump down to about 50, that's too low, right? 500, I know that's high.
It's usually it's a little individual. It depends on you, but a lot of people at 50, blood sugar at 50, if you're diabetic,
Yeah.
that'll be too low, and you'll notice some symptoms from that. Okay,
Yeah.
so a lot of people that'll be too low. Some people can tolerate it that low, but if you take your blood sugar a lot, which you should if you're diabetic anyway, just so you can kind of know your range, you keep it within that range that's healthy for you, whether it be like 60 to 120, like where exactly, like they want you to kind of stay, because if it's too low, you bring it back up, too high, back to low. Makes sense?
Is it true that as African Americans, we hold more salt or water in our body, so we have to watch it?
That's right. You guys, you even have to be more particular about it, because they're doing more studies now on we get better and better data all the time, so we can tease out, because medications that work for, say, African American versus white versus Hispanic are different. Same medication, different groups of people. Some work differently for males and females. Okay, so we're getting better all the time on kind of getting that kind of worked out, so we can tailor the medications best for the person.
Right.
Okay, but yes, you're exactly right. When it comes to with salts and whatnot like that, definitely want to special attention to salt in the diet, because you'll notice after a bunch of popcorn or whatnot, it'll be a little
stresses, things like that, you know, what's it up?
That's right. Stressful situations and whatnot that can cause a increase in blood pressure.
Be just scrolling there.
Yeah. Yeah.
A hyperactive person, it seems that their blood pressure is always up.
It seems like they probably would. You know what I mean? Not always, but it's certainly possible. Like people who are really active and always
Right.
going a little bit nuts.
Right.
They certainly can. It's like you want to watch out. Sometimes one of those things. Other times your body will get accustomed to it,
Right.
and then it'll just come back down to normal, and that's just normal for them.
Right.
You know, for them to be kind of their body has adjusted to it, so their blood pressure is adjusted down anyway. But you're right. Like a lot of times, people who are very even-tempered, they're under really stressful situations. They can have a spike up in blood pressure. If you have those other kind of risk factors, such as high blood or high cholesterol, other things, you can have a stroke at that point. So, did you? So that's not uncommon at all.
There's another question. Like stress. Stress can send your blood pressure increase.
Yes. 100%. You got it.
Stress.
Yep.
The
It
stress.
can definitely increase your blood pressure. You know, depending, it's probably not completely totally off because it's tough on your arteries, it's tough on your heart, it's tough on the arteries into your brain that can cause a stroke. There's a lot of things that stress can cause. It's really hard for us to measure it as doctors. Stress, because what's stressful for one person isn't stressful for another person. So it's hard to measure it, you know what I mean? And be really objective about it. And we don't have any medication to be like, if you're stressed out, you should take this. And it works for everybody, you know what I mean? We don't really have that perfectly yet. So,
Depends on one to talk to help you from the stress. Like
Right.
psychologists and
yeah.
stuff.
So you have like a psychologist, if you have depression, there's medication, there's certain things that'll help, but usually it's a, you know, like you need kind of a social support system, or you need something like that so you can actually, you know, like kind of chill out or get away from the stressful situation in some way or whatever. Yes. Yes. Melatonin? Really? Well, it is, yeah. It relaxes you too. A lot of times melatonin will help out like kind of your, what they call the circadian rhythm. So like if you're kind of off balance, like you're kind of like staying up too late, sleeping in, you're kind of off balance, it helps you out with that quite a bit, okay? That's stressful situations. I think it certainly could, I don't know. Does it help you out?
Before I go to the doctor, I take two.
All right. Anybody else? Questions? Everybody's got their ways to prevent a stroke down today, huh? All right. Thank you guys very much. I really appreciate you guys coming.
Thank you.
You better get started on your 22s too.
I see that.
There we go. That's a lot.